When we talk about characterizing your dizziness, we primarily want to know the following. What makes it worse? What makes it better? Are your symptoms constant or do they fluctuate? How long do your symptoms last? Seconds, minutes, hours, days? Are there any patterns to your symptoms? Poor sleep, stress, allergies, specific activities, other illnesses, changes in your hearing, fullness in your ears, or ringing in your ears? We can begin to create what we call a working diagnosis simply by reviewing your past medical history, putting your symptoms into categories, and categorizing your symptoms. The majority of the time, an accurate diagnosis can be formulated just from clues from your history. Here at 360 Balance and Hearing, we provide cutting-edge diagnostic testing and comprehensive clinical exams, but we never underestimate the power of your words. Your words are invaluable diagnostic tools. Let me give you an example of how much we can gather just by your symptoms. So you describe your dizziness as a spinning sensation. The world is spinning around you. You explain that your symptoms are brief, less than 60 seconds, and worse when you lie down in bed, roll over, bend over, and sometimes when you look up quickly. It may not happen every time, but it's pretty consistent and occurs almost every night. It also appears worse when you roll over to your left side, although it might occur on both sides. The most likely explanation is benign paroxysmal positional vertigo, or BPPV, what we like to call loose ear crystals or loose ear rocks. It's the most common type of brief spells of vertigo related to position changes, and we can typically treat it successfully in 1 to 2 visits, although some cases are more complicated. Let's say you slightly change your story to a spinning sensation that lasted hours to even days with nausea and vomiting, and you went to the ER. They diagnosed you with vertigo, and you were given medication for your vertigo and your nausea. The spinning sensation has stopped, but you still have this dizziness and movement-related unsteadiness. Movement does typically make it worse. The most likely cause is an inner ear infection, especially if you have never had an event like this before. Keep in mind that inner ear infections are single events more than 95% of the time, so if you're having repeated spells, then something else is likely going on. Now let's say your spinning vertigo lasts 20-30 minutes, up to a few hours. It may take 1 to 3 days to recover, then completely goes away. You may also have nausea and vomiting, fullness in your ears, or ringing in your ears. Your spells can be years, months, or days apart. This is most likely related to a fluid problem of the inner ear. Vestibular migraines may also be the cause. These are just a few examples of how people can report spinning, but the characteristic about their vertigo indicate different causes. And some people have experienced all of the above. For example, you may have been diagnosed with an inner ear infection, then years later you begin to have these repeated spells that indicate a fluid problem. Or you may also have BPPV. It's common with fluid problems of the inner ear, and especially with migraines. Here are some examples of other clues not related to the room or world spinning. It's more of a feeling in my head, almost like my eyes and head movement don't match, or my eyes are catching up to my head. It's worse with rapid head movements and quick turns. This is a strong indication that the inner ear simply isn't working properly. It may not be related to BPPV or a fluid problem, a virus, or migraines. Or you say the feeling in your head is worse when your head is still, like when you're reading or working on the computer all day. This suggests that your visual system may be involved due to decreased focusing skills or eye teaming skills. Dizziness with both your head moving or even being still can also come from your neck. So if you're seeing a healthcare provider about your dizziness, the exam should be very comprehensive and include assessment of your visual system, not just how well you see, but how well your eyes move and work together, your strength and range of motion, your coordination, the sensation, especially in your feet. Lack of it can be related to balance problems. It's a critical part of the exam. Your standing balance. Some tests may be eyes open, some may be eyes closed. What's your balance in walking, including walking with head movements, quick turns, or stepping over objects? Your eye and head coordination, which compares your vision when your head is still to your vision when your head is moving, is particularly important. And examining your eye movements in various positions. Even if you have comprehensive inner ear testing, such as a VNG, all the above should still be performed, ideally by a vestibular therapist, although some of you may not have access depending on where you live. More sophisticated testing can be used to identify certain diagnoses, and there are things in the clinical exam that we cannot observe without more advanced technology. However, the clinical exam can find things that sophisticated testing cannot. So if you've had imaging like an MRI or CT scan or a V&G and it was all normal, a comprehensive clinical exam can identify things that this testing cannot. And remember, it all starts with a review of your history and obtaining as much information possible about your symptoms. Successful treatment begins with a successful diagnosis. Next, we'll talk about some treatment options for the various types of dizziness.